What I learned from this course is the adaptation of economic policies from the new economic policy until now, which we have the Rancangan Malaysia 12, and what we adapted from each economic policy and or policies developed in Malaysia. And what we want to achieve, overriding objective, is national unity.
In this course, I learned about history of Malaysia's development before independence till today, especially in transformation process, industry and transition to service sector.
What I love about this course is that I get to know all about Malaysian economic history from before independence and until now.
I like this course because it made me want to know more about the Malaysian economy in various sectors such as agriculture, services and so on. Besides, I had learned on where to get the data either from national or international sources and how to use them.
From this class, I have learned about the growth of the Malaysian economy since the British occupation until now. What I like about this class is the way Dr. teaches us, because he teaches with diligence and sincerity.
I like this course because it has a long history of economic policies that transformed since early 1917, not only in Malaysia but also around the international countries.
What I learned from this class is on how to find statistics and data of Malaysia's economy. And what I like most about this class is that Doctor knows what he is teaching and he gives us additional knowledge for future purposes.
I like this course because I gain new knowledge on how to find economic statistical data more easily and faster via website of TOSM, World Bank, BNM, IMF and so on.
Through this course, I've learned that Malaysia has successfully diversified its economy from the one that was initially agriculture-based to the robust manufacturing and service sectors. The best thing about this course is it's highlighted and elaborated about every single important facts about the Malaysia economics that I need to know.
In this course, I've learned about the history of Malaysian economy and various macroeconomic issues. I love this course because I am able to analyze sources of economic growth of the country and identify our country's economic prospects on how to deal with the economic problems we face.
On December 31, 2019, China reported a cluster of cases of pneumonia in Wuhan. The new coronavirus, too small to see, spread quickly from person to person, town to town and country to country, to all corners of the world. Any one of us can spread it and get sick when a person infected with coronavirus or COVID-19. COVID-19 is continuing to spread around the world with more than 230 million confirmed cases and over 4.7 million deaths across almost 200 countries. On the 25th January 2020, the first case of COVID-19 was detected in Malaysia, who previously had close contact with an infected person in Singapore. Malaysia's COVID-19 cases drastically dropped in the middle of the year, but picking up again when it saw the third wave of epidemic after Sabah's election.
Next, I will talk about the first MCO in Malaysia. Malaysian Movement Control Order is a series of national quarantine and current sanitary measures implemented by the federal government of Malaysia in response to the COVID-19 pandemic in the country starting on 18 March 2020. The states involved is Kedah, Selangor, Federal Territory of Kuala Lumpur, Melaka, Johor and Federal Territory of Putrajaya. Next, SOP for first MCO. First, interstate and inter-district travel are not allowed for not fully vaccinated individuals. Second, not fully vaccinated individuals are allowed to travel in 2 passengers only per car. Third, the closure of all educational institutions for 14 days. Meetings, seminar, workshop, course training and lectures must be conducted via video conferencing. All essential services are allowed to operate with the Ministry of International Trade and Industry approval. Essential services of the ministry sector operate with 60% workforce capacity.
Next, moving on to the business or economic activities that affected because of pandemic COVID-19. Inside of positive is e-commerce industry and the other side of negative is travel and tourism industry. In stark contrast, the e-commerce industry was among a few sectors that were able to capitalize on the pandemic. What used to be an alternative form of shopping suddenly became an essential service. According to global data analysis, fear of virus infection through cash handling and social interaction at physical store propelled Malaysian e-commerce growth 24.7% growth in 2020. For example, Lazada Malaysia garnered a 120% increase in sales in 2020 compared to 2019, and the industry grew so rapidly that it is now the source of new employment as freelance drivers or riders for those who lost their job. Unemployment is unfortunately but undoubtedly increasing in many industries, but weak demand due to restriction has left the tourism and travel industry severely impacted. AirAsia has retrenched 2,400 employees and is flying only 8% of its Malaysian routes, whereas Malaysia Airlines has left over 13,000 employees on unpaid leave. Malaysian Association of Hotels MAH have claimed that MCO 3.0 has left 61.13% of workers on unpaid leave. According to MAH, only 70% of hotels are still operational with average occupancy rates below 20%. Aviation has lost RM 13 billion in 2020, while hotels have lost RM 11.3 billion since 2020 without any clear signs of recovery.
Okay, so we will continue this presentation about COVID-19 issues. So I would like to talk about the impacts of COVID-19 on the Malaysian economy. So first, I would like to talk about the impacts of COVID-19 on jobs and employment in Malaysia. The implementation of the MCO gave rise to several issues from an employment perspective, as most employers, save for those involved in essential services, had to shut down their business operations for long periods. Employers were faced with cash flow issues as they were unable to generate revenue during this period, and as a result, the sustainability of their businesses became a major problem. Employees, on the other hand, were faced with possible cuts, deductions from annual leave, utilization of annual leave and retrenchment as employers struggle to keep up with their contractual commitments towards their employees in light of their business having to shut down. So first is a payment of salaries. An employee's salary must be paid in full in accordance to his or her employment contract during the MCO. This applies to all employees, including those employees involved in non-essential services who are unable to work during the MCO. For employees whose salaries are not fixed, then they must be paid a daily wage in accordance to the minimum wage prescribed under the Minimum Wages Order 2020. So second is annual leave reduction. An employee's annual leave should not be deducted during the MCO. The Ministry of Human Resources has stated that no deductions can be made from an employee's annual leave entitlement as the MCO has been implemented in accordance to the Prevention and Control of Infectious Diseases Act 1988 Act 342. So lastly is unpaid leave. Generally, employees faced with financial difficulties due to business or economic downturn can implement measures such as requiring employees to go on unpaid leave out of good faith and to avoid having to go on retrenchment exercise. However, as the Ministry of Human Resources has stated that the salaries of employees must be paid in full during the MCO, it is implied that employees are not allowed to require their employees to go on unpaid leave during the MCO. Okay, so we continue the impacts of COVID-19 on the retail industry in Malaysia. So the drastic changes in the external environment caused by COVID-19 have had various effects on the business of the retail industry. The crisis has created stark contrast in business performance between types of business operations. Due to the government's request for essential business continuity, retail businesses that handle food and daily necessities such as supermarkets, drugstores and convenience stores have remained in good conditions as consumers wait in long lines at cash registers to buy products, many of which have even sold out. So that's all from me.
Other than employment and retail, COVID-19 has also affected the inflation rate in trading like 1.7% and also clothing and footwear with negative 0.8%. Other than that, the inflation for urban in 2020 rose more than the inflation in rural areas. The inflation gap between urban and rural widened since 2014 and continued to increase up to 3.4 index points in 2020. At the same time, purchasing powers between in urban areas was lower than rural areas with 17.1% and 14.7% respectively. Next, in 2020, Malaysia's exports of services recorded RM92.6 billion. At the same time, imports of services decreased to RM 140.1 billion ringgit. The international trade in services deficit widened to 47.4 billion, which recorded the highest deficit ever. Malaysia's total trade in services contracted by 33.8% to 232.7 billion ringgit. Total trade in services as a contribution of GDP, which is gross domestic product, accounted for 16.1% in 2020.
Change in technology during the pandemic, digital home environment. Before pandemic, we will work or study via face-to-face in office or educational institution. But when pandemic or maybe post-pandemic will be happen, we will work or study also via online, such as Google Meeting, Zoom, Microsoft Teams, and so on. Information and communication technology, the implementation of 5G, Internet of Things, virtual reality will quickly. The latest technology will be published to public for all users, such as VR in clothes. When we wear the VR clothes on face, after that we can imagine ourselves to fly and controlling like drones and birds, even though we are at home. Implement information mobile apps, so we more often always check our phone to more get near information like news of COVID-19. We'll also use our phone to check in and scan QR code via MySejahtera apps when we visiting a place. Digital economy, e-commerce. When the pandemic COVID-19 happened, the entrepreneur, especially small medium enterprise, must be adapt with new normal via through e-commerce like Lazada and Shopee. This pandemic put the customer and entrepreneur to the cashless transactions such as touch and go e-wallet, POS, and so on. It is because when we use the banknotes, we have a probability to infect of COVID-19 through banknotes. So to avoid this happen, cashless is the best alternative for us.
Moving forward to the government action to recover the national economy and its people. First is Economic Stimulus Package 2020 announced by Yang Ahmad Tun Dr. Mahathir bin Mohamad on 27th of February 2020 with budget of 20 billions to accelerate the economic activities through utilizing strategic domestic resources in order to generate Asian Malaysia with three main strategies, which is mitigating impact of COVID-19, spurring rakyat-centric economic growth and promoting quality investment. Next is Laksana, established by Ministry of Finance on 16 March 2020. The main purpose is to research, monitor and ensure the economic stimulus packages introduced by the government will reach each level of the people and mitigate the impact of COVID-19 toward the economy of the country. Next is Prihatin, announced by Yang Ahmad Tan Sri Datuk Haji Muhyiddin Yassin on 27 March 2020 with budget of 250 billions to protect the welfare of people, supporting businesses including small and medium enterprises, as well as strengthen the country's economy to weather the effect of the COVID-19 pandemic with three goals, which is protecting rakyat, supporting businesses and strengthening economics. Next is Bencana, announced by Yang Ahmad Tan Sri Datuk Haji Muhyiddin Yassin on 5th June of 2020 with budget of 55 billions to accelerate the economic activities through utilizing strategic domestic resources in order to generate ZULAIKHA Malaysia with three thrusts, which is empower the people, proper businesses and stimulate the economy. Next is PERMAI announced by Tan Sri Dato' Haji Muhyiddin Yassin on 18 January 2021 with budget of 15 billion. Aim is to providing vital support to businesses and the general public who may be affected by the new lockdown measure with three main strategies, which is combating the COVID-19 outbreak, safeguarding the welfare of the people and supporting the business continuity. Next is Pemekasa announced by Tan Sri Dato' Haji Muhyiddin Yassin on 17 March 2020 with budget of 20 billion. Aim is to boost economic growth, support businesses and provide targeted assistance to the people and sectors that are still affected by the pandemic or the movement control order. Next is Pemekasa Plus announced by Tan Sri Dato' Haji Muhyiddin Yassin on 31st of May 2020 with budget of 40 billion. Aim is to support the healthcare sector, businesses and Malaysian as the Malaysia head into a total lockdown with three main goals, which is enhancing public health capacity, continuing the Prihatin Rakyat agenda and supporting the business continuity. Lastly is Pemulih by Tan Sri Dato' Haji Muhyiddin Yassin on 27 June 2021 with budget 150 billion. Aim is to reduce costs borne by employers, encourage digitalization effort as well as provide financial support and tax incentive. With three main strategies, which is continuing the Prihatin Rakyat agenda, supporting the business continuity and expediting vaccinations.
The National Recovery Plan announced by former Prime Minister Tan Sri Muhyiddin Yassin is a four-phase exit strategy from the COVID-19 crisis. The strategy of National Recovery Plan is based on three indicators. The first one is COVID-19 transmissions among the community based on the number of daily COVID-19 infections. Second one is capability of public healthcare system based on the bed utilization rate in ICU wards. Third one is how much of the population is protected against COVID-19 based on the percentage that has received 2 doses of vaccines. The first phase of the plan entails the implementation of the Full Movement Control Order FMCO in light of the high COVID-19 cases, critical state of the healthcare system and low vaccination rate. The government will then consider shifting into phase 2 of the plan if average daily COVID-19 cases fall below 4,000, the healthcare system is no longer at the critical stage with ICU bed usage returning to moderate levels, 10% of the population has received 2 doses of COVID-19 vaccines. The restrictions include economic activities, reopening in phases with up to 80% of workers allowed on site. Only certain sectors will be allowed to operate. The government will add more sectors to the current list, such as cement manufacturing to support construction activities and sales of computers and electronic devices to cater for those who work from home, and no social activities and interstate travel are allowed. In phase 3, all economic activities except for those with high risk of COVID-19 transmissions and involving large gatherings will be allowed to resume. The government will consider shifting to phase 3 if average daily COVID-19 cases fall below 2,000. The healthcare system is operating at a comfortable level with ICU bed usage reduced sufficiently. 40% of the population has received 2 doses of COVID-19 vaccines. All economic sectors will continue operating at 80% capacity. Manufacturing activities will be allowed, subject to SOPs and capacity limits. Banned activities where physical distancing is not possible include holding conventions and reopening pubs, spas and beauty salons. Sports and social activities may resume in stages. The government will consider moving on to phase 4 or the final phase when average daily COVID-19 cases fall below 500. The healthcare system is at a safe level with ICU bed usage at a sufficient level. 60% of the population has received 2 doses of COVID-19 vaccines. All economic sectors may reopen and daily activities may resume, with more social activities allowed, interstate travel allowed, and domestic tourism permitted subject to strict SOP compliance. During this phase, COVID-19 cases are low, the public healthcare system is at a safe level while herd immunity has been achieved at year-end by the latest. The government is expecting an additional 16 million doses at the end of July, which coupled with the higher daily vaccination rate gives the government confidence in executing the National Recovery Plan.
So for the question of how long COVID-19 will be with us, so this pandemic's course, COVID-19 course, will depend totally on the immunity and vaccinations. So how many people have been vaccinated, fully vaccinated? So we estimated that people have been fully vaccinated by 2022, and with this, after that, we check on the immunity. If everybody has been vaccinated, the immunity of the vaccine, how strong is it? And with the strength of the vaccination and the immunity, how long will it last? So if it's moderate, it's seen that we could have this COVID-19 and end around 2024, but without any surges of COVID-19 infections or spreads. And also that if the immunity is weak, also we've estimated that it could end by around 2025, but not sure when, early or end. So for the question of will Malaysia succeed in eradicating the problem, what's the problem? The problem of COVID-19, the pandemic. So in an article in Malaysia Kini recently, Anwar Musa and MP ministers talked about the indicator of success in COVID-19. He said that when people are no longer afraid of COVID-19, it shows that we are being a success. Whereas, he also compared to US and UK, the stats of the death toll and the infected cases shows that Malaysia is doing well than other countries. But it's actually Malaysia succeeding. So Malaysia is not considered being a failure because every day people are giving free vaccination shots. But we cannot have succeed in our case if we are satisfied with what we have, or satisfied with the way everything is being implemented. So everybody will have to play their own important roles. Malaysia needs a win against the COVID-19 coalition government where all political parties work together, citizens play the important roles of social distancing, and so we can reform the societal damages and economic losses we have.
Next, what Malaysians can do in order to stop or prevent the spread of COVID-19. Firstly, the government can adopt the Coronavirus Aid Relief and Economic Security Act that is implemented in the United States of America right now, and also help with the public health measures by improving and also supplying more on the medical technologies to all the COVID-19 patients. Meanwhile, us, the rakyat, firstly, we need to improve on our personal precaution by taking care of ourselves and always wear a mask. And also, please spend money wisely, especially during this COVID-19 phase, because we never know what's going to happen next. And they said, cut your coat according to your clothes. Okay, so lastly, what will happen after the COVID-19? We all need to believe that COVID-19 will never disappear, but instead remain with humankind and become endemic. So what is endemic? Endemic refers to diseases that are constantly present in the population. Right now, Malaysia need to keep the community as a whole safe while accepting that some people may get affected every now and then. To the economy, should COVID-19 indeed prove endemic, it is likely to be a slower journey to get the global economy back to normal. It will get back to normal, but it may take some time. And also, next, much of the global economic recovery prospects will be dependent on the trajectory of monetary and fiscal policy to create a better economy for a country. So that's it from us. With that, stay home, stay safe. Thank you.